Hello, it's Dr. Rhonda Johnson, and today is Wednesday, May 5th, 2021. And today I'm going to be discussing the COVID-19 vaccine for adolescents. Well, many parents of teens are very hopeful. You know, our teens have been in social isolation for more than a year. For many teens, that has meant limited sports, very restricted after-school activities, virtual school, no summer camps, no summer internships or summer jobs, a lack of gatherings with friends and recreational opportunities. Many teens have suffered from social isolation, depression, anxiety, stress, all kind of mental health issues because of the pandemic. And for some parents, this is the reason why they are anxiously awaiting approval of the Pfizer vaccine under Emergency Use Authorization for adolescents between the ages of 12 to 15. So let's talk about that. So Pfizer, one of the manufacturers of the messenger RNA two-dose shot, had enrolled almost 3,000 teens between the ages of 12 to 15 in a clinical trial for their COVID vaccine. Moderna also has a clinical trial of their vaccine in 12 to 17-year-olds. Recall that the Pfizer vaccine is approved under Emergency Use Authorization for teens 16 and up. The Moderna vaccine is approved for young adults 18 and up. So back in March, Pfizer released publicly that their vaccine provided excellent protection for the younger population. Again, they had enrolled volunteers between the ages of 12 to 15, almost 3,000 of them, in a clinical trial for their vaccine. Now, they received the same dose as adults did, and there were no cases of COVID-19 among fully vaccinated adolescents in their clinical trial, compared with 18 cases of COVID-19 disease amongst those who received the placebo shots. Pfizer also reported no serious safety concerns. The side effects were the same as adults: sore arms, pain, fever, chills, and fatigue, particularly after the second dose. Now, their clinical trial will continue to track participants for 2 more years for more information about long-term protection against COVID and vaccine safety. So what should parents do, parents of 12 to 15-year-olds, if this vaccine is recommended under emergency use by the advisory committees of the FDA, CDC, and approved by the FDA? Well, I have some tips. Number 1, discuss it with your adolescent now. Get their feelings about the vaccine. Share this video. Share what you know. Number 2, if you have been vaccinated, share your experience. They probably already know that you've been vaccinated. Or if you haven't been vaccinated, talk to your teens. Don't let your decision around vaccination cloud their opportunities. Number 3, discuss with your children's healthcare provider. Review their allergies, any chronic conditions that they have, etc. Number 4, I recommend that you think about your child's future and include their social and emotional well-being today. What's it going to be like for them to be unvaccinated if their friends are vaccinated? Many of their school classmates are vaccinated. Number 5, talk to your kids who want to do sports, be with their friends, go to summer camp, be in band or orchestra. Remember what a normal teen lifestyle would be pre-pandemic, and find out if your teens want to try to get back to as a near normal life as possible. Number 6, know that older teens are more likely to spread COVID. Their likeliness is the same as young adults. Number 7, particularly if you have 17-year-olds, who are about to be seniors and going off to college, know that more colleges and universities are requiring COVID vaccination for students who are going to be living on campus. So they are requiring that they be fully vaccinated before they come to school. Now, Rutgers University in New Jersey was the first, but many other schools have followed, including Duke University, the University of Notre Dame, Brown and Cornell, Washington University in St. Louis, Northeastern University, and Cleveland State. And I'm sure I'm leaving off others. But many schools are going to require fully vaccination with COVID-19 vaccines for students living on campus. Number 8, know that the vaccine safety has been well established in 16-year-olds and up and 18-year-olds and up. And lastly, my bit of advice is if you have decided with your doctor and your teen, your adolescent, that you're going to get vaccinated, well, don't wait until just before school starts if you make your decision. Because remember, it's going to take 2 doses, 3 weeks apart for the Pfizer vaccine to be fully vaccinated, and then 2 weeks after that. Lastly, we must always remember there's no hesitation among the SARS-CoV-2 virus that causes COVID-19. It's not hesitating at all. It's glad to go from host to host and replicate itself and then go on to infect other people. So that's my message today. As always, my views are my own. Stay tuned for more news about the Pfizer vaccine. Again, approval is expected, but it hasn't been granted yet. Okay, stay safe, folks, and as always, have a blessed day.